My mentor from fellowship, I feel like I've done so many cases with you, learning how to do transeptal puncture, left atrial appendage occlusions. Can you introduce yourself?
Yeah, I'm Kristopher Heinzman. I'm one of the electrophysiologists at the University of Texas Ascension Medical Center in Austin.
So you've taught me so many things that I now use in the lab for my own practice. And I'm a plumber at an electrical conference, and I feel very welcome here. And so my question for you is this. Pulse Field Ablation is kind of taking the main stage here at this meeting. How have you integrated that into your practice?
Everybody is kind of learning that, and I think it's a little bit, different for those of us that are still in education. It's very exciting to have new technologies that offer an ease that wasn't there before. It's exciting to have something that, a skill set is probably more easily translated throughout smaller practices around the country, around the world. But we don't yet know that we're at a place where the skill set of being able to work with a radiofrequency ablation catheter in the left atrium is something we want to give up forever. And I think as we continue to train electrophysiologists that are then going to go out and practice in the world, I think you run the risk of training people who lose that skill set if all you do is PFA for the 2 years that you're in training. And so then that, brings very difficult clinical questions as far as, all right, which patients do you choose for PFA? Because we are integrating it into our practice, but also, which patients then do you reserve for radiofrequency ablation, and how do you make that distinction before the case? It's a very challenging thing. And, you can use things like atrial size, and you can, we use a lot if somebody has an atrial flutter that we know we're going to be treating as well, although clearly people are publishing and learning how to treat flutters with PFA. I think that's an easy selection of patients where you can still get the old radiofrequency technology in use and in the hands of the fellows so that they can learn and then maintain those skills of working in the left atrium with that equipment.
I think it's a really important perspective you bring up about having trainees in the environment and what that means for translating clinical practice for their own use in the future. Mm-hmm. I learned so much from you I had an aha moment in the cath lab with you for transeptal puncture, and you're one of the best teachers I've ever had. So what, in your mind, makes a person teachable in a lab environment?
Yeah, there's a lot of things that go into that, and it's a long conversation with each of the fellows that we have. Obviously, being teachable means listening from the start. I think, two, having a willingness to recognize when you are uncomfortable. I think in the lab, the first way to lose trust with your mentor and your teacher is to be appearing to take chances for the sake of trying to get experience and do things that may be outside of your current skill set. And so, having the ability to recognize that something feels uncomfortable and this is a time that I should ask for help. Once you establish a trust with the person that's teaching you and your mentor, that I can know and feel comfortable that you're going to ask me for help when help is necessary. Well, that's the first step in gaining trust in that setting, and then being allowed to work with more independence as time goes on.
I think that's a beautiful answer, and it kind of goes back to everything we do in medicine. It's all about building relationships and trust with the team around you. And unrelated to all of this, what is something that lights you up outside of the lab when you're not doing procedures and you're not on call?
It's always going to start and end with family, and so I'm blessed to have a wonderful wife and 3 amazing kids, and trying to spend as much time with them and not miss them growing up is the highlight of every day. And so that's it. We try to be together outside as much as possible, whether that's hiking, visiting national parks, camping, mountain biking, just doing as much as we can.
Amazing. And this is like a rapid fire. It's like one word or like 1 or 2 word answers. So what's your favorite EP procedure?
Atypical atrial flutter.
Ooh, specific. Yeah. What's on your scrub cap in the EP lab?
Nothing. It's blue. All blue.
What song is playing in your lab?
Oh, well, if I have control over it, which I don't always do because the nurses and the team will often take over, we generally pick a Spotify radio, and right now that's either Camp or the Red Clay Strays.
Amazing. And then what is your ritual after you get through a really tough case and get a good result? Do you treat yourself?
Well, my ritual is we have fellows, right? And so we try to debrief. Whether it's a tough case, a good result, I think we want to take that time when it's fresh in the mind and kind of what can we learn from this case? What could we have done differently? What can we do next time? And then what do I want them to take from this as they go into practice that they can lean back on when they run into tough kind of situations to say, hey, I remember this. I was in this spot before.
It's like another pearl of wisdom from my mentor. I'm going to actually implement that in my own practice. So thank you so much for your time.
Absolutely, yeah.